some of the items that are included in this. Expands eligibility for the Medicaid for Employed Persons with Disabilities program from 250% at the federal poverty level to 300%. Excludes pension accounts from income eligibility determinations, allowing disabled Iowans to plan for their future. Increases the base reimbursement rate for home and community-based services providers in rural areas to cover the travel time and expenses incurred. Amends rules regarding the rates in special population nursing facilities to allow for the transfer of high-need individuals from child serve to On With Life. Requires DHHS to convene a work group to examine the unique services need of high acuity pediatric recipients of Medicaid and Hawkeye, with a report due to the legislature. Prioritizes Iowans by requiring at least 12 months of residency in Iowa in order to qualify for public assistance. Codifies citizenship and qualified alien status as a universal requirement for all public assistance eligibility. And we're also catching and preventing fraud by requiring the Department of Inspections and Appeals and Licensing to submit an annual public assistance fraud report. This bill also helps bring us in alignment after some federal changes with one big, beautiful bill. With that, I'm going to open it up to the public to be able to come to the table, speak. We have plenty of chairs up here for the sake of time. Don't wait to come up to the table. When you're ready to speak, go ahead, fill the chairs. We'll go around the room. So anybody that would like to speak, please come forward now. And once you're done speaking, please leave the seat so that other individuals can fill it. So with that, I'll turn it over to you. I also want to say real quick, for the sake of time, I'm not going to put time limits on right now, but please try to keep your remarks concise so that we can fit as many people in. Thank you.
All right, okay, sorry about that. My name is Zach Minkum. I'm an entrepreneur in Iowa with a disability, and I've spent a lot of time advocating here at the Capitol. When I heard that Medicaid asset and income limits were going to be addressed in House Bill 696, I was thrilled until I read the bill. And I'm going to be honest, what I saw when I read the bill was a very watered down version of what we asked for, wedged in between a lot of policy that's going to harm so many other people. And I would be remiss to say, if I didn't say, that there is no policy regarding income and asset limits that could be in this bill that would make me be okay with taking away food assistance from children, undocumented or not. I don't know if you guys know this, undocumented children do not enter this country on their own volition. And even if they did, starvation is not an adequate penalty. And it's very disappointing to me that I have to say that out loud, but here we are. With that being said, I did come here as a disability advocate. So I want to address the asset and income limits issue directly. House Bill 696 raises the income limit from 250% to 300% of the federal poverty line. That is a step in the right direction, but Iowans with disabilities deserve to be doctors and lawyers and engineers if they work hard enough. And their pay should be commensurate with their skill set. So if we're gonna have an income limit at all, it's my recommendation that it's at least 400%. So Iowans with disabilities can at least work to the level that they are capable of. House Bill 696 also removes retirement accounts and unearned income from the asset limit. I do believe that that's a step in the right direction. However, I don't believe asset limits makes any sense. I think it's an arbitrary limitation. And at the very least, Iowans with disabilities should be able to save enough to buy a house, to put a down payment on a house, to fix our very expensive vehicles. My van that I drove here costs over $100,000. And I should also be able to have a second vehicle, because if that vehicle breaks down, I have no other accessible vehicle to get me around. I'm stuck until it's fixed. And lastly, I want to see language about individual fraud removed from the bill, because individuals on Medicaid are not the ones committing fraud. Medicaid is not a cash benefit. There is no incentive for someone like me to defraud Medicaid. If you want to address fraud, you have to look at the providers that are committing it, not individuals. It's not us. And on a personal note, just to the people of the committee, I spend so much time advocating for these things because I believe in it and I want to work with you. And so I just hope that moving forward, we can work together to make this something we can all be proud of. Thank you.
Hi, Carlin Crowe with the Iowa Developmental Disabilities Council. First, I want to thank Representative Harris for including the provisions that Zach talked about from the Work Without Worry bill from last session into this particular bill. We were happy to see that we're making progress in that direction. But as Zach said, the provisions in that bill were to eliminate income and asset limits. This bill doesn't get there. We know that's a big leap. So as Zach mentioned, 400% of poverty level might get us a little bit farther down the road, but perhaps think of a tiered system. This year we go up to 350. Next year we go up to 400. And the year after that, go up to 450, and then study who's being affected by it. And let me give you some data that might not be made available to everybody. This data snapshot was really good that was mandated last year in the work requirements bill that helped us look at what's going on in surrounding states as far as limits. But what we're not looking at is impact. So, for example, the average income for a person on the MEPD program in 2024 was $1,583 a month for an individual and $1,856,000 for a household. So that's a long way from a 200% or 300% federal poverty level limit. They're not even getting close. It's more like 150% of poverty level, below that. And this is where the approximately 16,000 people on MEPD are gonna stay. Because at that level, they're not gonna lose their Medicaid benefits, they're not gonna lose their SSI benefits, they're not gonna have to pay a premium to MEPD. They can make a little bit of money and have a little bit of spending money. They're probably gonna be on SNAP. That probably makes them eligible for SNAP. So if they are able to work, they have no incentive to earn more or work more hours because they can sit very comfortably in that spot. So even if we're trying with limits to move them out of public assistance programs, right now they're caught in a poverty trap. The other trap that another population is caught in is higher end earners, who Zach mentioned a little bit. So we have people who may be working full-time, making good wages, and have an employer-sponsored plan. But because of their disability, they need help in the home getting ready to go to work in the morning or coming home at night and getting ready for bed. So they have to have personal care. Personal care isn't covered under private insurance. So they're on Medicaid and MEPD specifically. And if they make too much, they lose that. And so that's the healthcare trap that these folks are under. So the question is, what's our goal with this bill? If it's to incentivize more people to work, then just talking about limits and the punitive side is not working. We need to work in some incentives for people to be able to earn more and to save more too. I'll be happy to talk about amendments afterwards. I know my time is up. Thank you.
Just for the sake of time, we are going to have our staffer Natalie put a timer on for 3 minutes moving forward on this. So,
thank you, Mr. Chair. Dennis Tibbin on behalf of the Foundation for Government Accountability and the State Policy Network. Both are registered undecided as they're completing their analysis of the bill. Generally speaking, we are supportive of the oversight and conformity pieces that are included in here. Really appreciate the thoughtful approach to making sure that we are aligning with the recent federal changes, averting any of the potential reductions in federal matching rates. And we will be working, we've had several conversations with the department already and intend to bring you some potential refinement recommendations to make this bill even stronger, and appreciate your attention to the matter.
Thank you, representatives. My name is Jacob Schrader, and I represent a group of 6 home and community-based providers. I want to thank the representatives here for the inclusion of that increase in the MEPD rate threshold that you've heard a little bit about today. Right now, Iowans on disability who want to work are forced to choose between contributing to their communities maximally the way they want to, the way their communities would like to have them, and retain their benefits. And this is a good step in the right direction when it comes to allowing those individuals to fully commit to the best of their ability in their communities. I also want to thank for the inclusion in the travel time for the HCPS. When we're talking about home and community-based providers, that does inherently mean travel to where those individuals are. And that is a model of healthcare that is great success at keeping individuals in their homes, in their support systems. And I just want to thank the inclusion of that recognition of that. Those are hard healthcare costs that are borne by our providers. Thank you.
Good morning. First up, I have to figure out how to work the mic. My name is Catherine Johnson. I'm the Executive Director of Iowa's Protection and Advocacy Center. We're called Disability Rights Iowa. I'm here today to address some of the concerns and questions from the disability community, specifically really looking at the medical assistance program and some of the eligibility considerations and changes within this proposed legislation. My comments are not going to address the supplemental food assistance program. I believe there's other organizations here that will talk about that. I want to first start by reminding us of what MEPD is and how unique of a program it is. This is the only way that Iowans with disabilities that would want to work, that need personal attendant care to be able to get ready to work, to get to work, can have access to that. There is no support for that outside of this program. Private insurance does not cover that kind of assistance, nor can you, under the Americans with Disabilities Act, ask for an employment accommodation and have your employer pay for it. So this is it, which I think is an important starting point. Because of that, because of the lack of kind of information about this program, my office last year did a very in-depth qualitative survey, and I will make sure that each member on the subcommittee has a copy of that later. It's also on our main website if you'd like to look at it. But in short, we had 140 Iowans with disabilities participate in that survey. I want to share some of the key findings that we had from that survey. 50% of the survey participants reported that they received their health care through Medicaid. They reported overwhelmingly that the Medicaid income and asset limitations impacted their ability to work more hours, and to accept promotions. A lot of them were concerned about ongoing job security because they were going to work off at a level that they were no longer eligible for that program. 69.3, so almost 70%, reported a desire to take that promotion and increase their salaries if the Medicaid and asset limitations were removed. And they all reported that that was a significant contribution for them and their inability to financially support their family. So based on that, what DRI is recommending that the committee consider for amendments is to increase the MEPD income limit to up to 400% minimally of the federal poverty income, to remove all of the limitations on the asset and resources for both individuals and families. As Zach said, that limitation prevents an individual with a disability who might have family from ever buying a house. They will never be able to save enough money for a down payment. They'll never be able to have a car. You know, we're forcing people to live in poverty. Well, two last things I want to point out is that currently federal Medicaid law has a cost neutrality in it. And secondly, the residency requirements of 12 months of continuous residency in Iowa violate both our current state law and violate the Federal Medicaid Act. Thank you.
Next.
Hi there, Mary Nell Treves, Iowa ACES 360. I'm going to zoom through several points, so bear with me. I'm going to start with Division 2, Section 10, something Catherine was just mentioning, because it has broad implications for several other policy changes in this bill, and that's regarding the cost neutrality for Section 1115 waivers. As Catherine mentioned, at the federal level, there's already stringent requirements for the cost neutrality on the federal side of things. But as you also may be aware, every 1115 waiver requires significant administrative and evaluation expense. So this provision could make it harder to advance waivers that the legislature has historically supported, including last session's work requirements or other pilots that need upfront investments. Obviously, there's a workaround in this bill where both chambers would have to approve anything that was not cost neutral. But in practice, that just adds additional bureaucratic step, and it doesn't really improve any oversight and could slow the waiver process, which is already quite lengthy. So now I want to turn to Division 4, Sections 16 through 20. These provisions would be directly impacted by Section 10. The $5 no-show fee in Section 16 would require an 1115 waiver. It would likely cost more to administer than it collects, and small fees are known to discourage timely care and push patients towards emergency rooms. Sections 17 and 18 create new cost sharing and contribution rules for the Medicaid expansion population, which again require a lengthy waiver process. Section 20 adds re-enrollment limits that increase administrative churn and risk coverage gaps that often drive patients to the emergency room. I would suggest strengthening MCO accountability for healthy behavior outreach may accomplish some of your goals with fewer downsides. Again, all of those sections would be up against Section 10 and the cost neutrality. I don't think any of them would meet it. Moving on to Division 3, federal law already prohibits durational residency requirements for Medicaid, SNAP, and WIC. So in this section, all you have is FIP and child care assistance, which residency is already verified with existing state procedures. Sections 13 and 14 of Division 3 simply restate current federal immigration verification requirements. In 2023, you all passed Senate File 494, which included substantial reforms to the public assistance program, and that law required HHS to comply with SAVE, which is referenced in Section 13 and 14. And just last month, the Public Assistance Oversight Legislative Report submitted to you all confirms that this requirement has been fully implemented, and HHS is currently using SAVE to verify eligibility. So for those reasons, I would recommend striking Division 3.
We do have only 7 or 8 minutes left on the clock, so please keep it brief.
Okay, quick. Amy Campbell, I represent several home and community-based providers, and on Section 9, we just had questions about, we appreciate this, but we had questions about how to fund that. We would be concerned if you're taking away other funds and redistributing it without adding additional funds on Section 9. And then moving on to Section 16, about the member's failure to meet a scheduled appointment, the $5 fee. We have some concerns about that, just because if you're working with a safety net provider, sometimes they have lack of transportation options, including people with disabilities. Sometimes their transportation provider is not on time, and if they miss an appointment for that, it's unfortunate that the person would be penalized for that. So I don't know how that would be operationalized, if there would be exceptions to that. And then I wanted to point out on Section 21, we really appreciate the inclusion of this language on special population nursing facilities. We're registered for On With Life as undecided right now, just because the language references Medicare, it needs to reference Medicaid, and we submitted some suggested changes to Natalie already for an amendment, but we will change to support for that after that language is changed. We really do appreciate that. This is going to help us with ChildServe move kids who are ventilator dependent into permanent care in the state once they age out. So we really appreciate this essential step forward in making that happen. Thank you.
Good afternoon. I'm Christina Hamilton with the American Lung Association in Iowa. We work on behalf of over 370,000 people in Iowa with asthma, COPD, and lung cancer. We're most concerned with the cost-sharing portions of the bill. Research is clear that premiums are associated with reduced care, including necessary services, worse health outcomes, and increased financial strain for families, including those making above 150% of the federal poverty level. Copays of even just $1 to $5 are associated with reduced healthcare services. And when patients do not see providers for routine care to manage their health conditions, they can end up with more serious complications that lead to emergency room visits and hospitalizations, which ultimately are more costly to the state as well as damaging to patients' health. And for people with lung cancer and other chronic conditions, they are going to more appointments, using more health care. So we're particularly concerned about the cost sharing portions. Thank you.
Thank you.
Good afternoon. I'm Kathy Underhill, the CEO of the Des Moines Area Religious Council. Our interfaith organization has spent the past 50 years feeding those in need through a network of 13 food pantries. I know that policy can seem, from 30,000 feet here under the dome, can seem very simple, but as you get closer to the ground where it's actually implemented, it becomes very nuanced and can have very dire unintended consequences. Based on that, I am here today to ask for a no vote on 696. And while there are many parts of this bill with which I agree or disagree, I'll focus on just one section. This creates a hurdle, not just a hurdle, but rather a vast moat around a public health effort called Women, Infants, and Children Program that provides vital nutritional support for pregnant and postpartum women and their babies. First, requiring 12 months of continuous residency in Iowa would mean, for example, that a woman who becomes unexpectedly pregnant while living in Omaha and moves back to Iowa to be close to family would not be eligible to receive WIC for her baby. Second, a baby's nutrition shouldn't be used as a pawn in much needed immigration reform. Simply put, this legislation would result in malnourished babies. That's not hyperbole. I see it every day, like the crying 4-day-old preemie I met in our pantry waiting room on a 5-degree day. This legislation will lead to more babies at more pantries that we may or may not be able to help because formula is $32 a can, and as a charity, we have a really limited budget. You may be thinking, well, let's pass this out of committee and we'll amend it later. And I would say, don't count on that to absolve yourself. A yes vote crosses a very bright moral line, in my opinion. It will create hunger among newborns, period. For what cut and paste language from authors sitting at a fancy desk in DC while you have to face your constituents with these consequences. If you vote to move this bill forward, I would ask that you pray for me and all the frontline people that are going to be looking women in the eyes that are trying to feed their babies, and all the crying babies we're going to see in the waiting room. We will definitely need those prayers and the strength to get through the consequences of this legislation.
Bill, you want to give it? We are getting very close to our 1 o'clock, and the Commerce Committee has to start in 2 minutes, so please, very, very brief.
Yep, thank you. Bill Jenner with the Iowa Food Bank Association, currently monitoring the bill. One question we had under section 6 in Division 1. So the Food Bank for the Heartland runs the SNAP hotline for the state of Iowa. So the question that I got from some of our folks that run that, what would be the responsibility for the SNAP hotline for our folks to verify or submit supporting documentation that would be required to consider an application complete? Because currently, SNAP hotline does not have back-end data with the department when they submit those applications to DHHS, and our folks think that we probably would need that, and I'm not sure the department would want a call center to get us. So question there, and happy to have a conversation about that moving forward. Thank you. Janie.
Hi, Janie Yates, Blank Children's Hospital. We're registered undecided. I want to give you a compliment. Thank you for including the pediatric acuity work group. We think that's a really positive thing. I would reiterate the comments about WIC, that to remind everyone, that's 100% federally funded. And so not only would we face newborns facing hunger, but that will actually add costs to the state because we will see those babies in the healthcare system struggling. So thank you.
Hi there, I'm Laura Hesberg with the Iowa Coalition Against Domestic Violence. I know folks have mentioned some positive aspects of the bill. Still, we are registered opposed because we are very concerned about the added eligibility requirements that make it harder in terms of documentation and just eligibility to apply for benefits. As you know, leaving a violent relationship often means that people lose economic security, housing, and the means to regain it. Sometimes decisions about being able to meet basic needs determine whether someone stays in a violent home or leaves, and these are very harmful provisions that you're doing. 12-month eligibility, the residency would be impossible for some of our folks who are mobile. Please vote.
Hi, Cindy Marshman, Iowa Occupational Therapy Association. We are registered as opposed due to the nutrition programs, which I think have been well stated here, the concerns. But I do want to compliment this legislation for including work without worry in some of those components. As a practicing occupational therapist, we see that individuals are paying out of pocket $36 an hour for four or more hours of care per day, or up to $60 per hour for 1 hour of care. So without this legislation, without these benefits, our members would have a significant impact. Thank you.
Tom Chapman with the Iowa Catholic Conference, including Work Without Worry Good. We do not support the changes in WIC based on immigration status. We want all children to thrive and all moms to thrive. I would just note that in the bill, you're not just disqualifying undocumented people, but also people who have temporary protected status or some other work authorization. Some of them would be excluded in this bill under the definition you have. Thank you.
Elliot Meyer here on behalf of ChildServe. First off, I want to thank you for the pediatric work group. I'm very thankful for that. Similarly to what Amy Campbell said, we're very excited to work more on the pediatric element regarding going to specialty hospital or specialty population nursing home. So thank you so much.
Okay, I'm going to ask my subcommittee members if they want to make any brief comments. Representative Wilbur.
Thank you. Everybody, thank you for your input. One of the challenges and problems with these type of omnibus-like bills is all the unintended consequences that arise. I don't support this. Any of the efforts that are going at fraud, I remember with, I think it was SNAP, there was a study done by the nonpartisan group. It found 0.007% fraud. This is related to SNAP, but again, I think any of the fraud prevention things go too far, create more problems, as folks just said. So I'll,
Representative Ingalls.
Yep, I'm going to go ahead and support moving this along. I think a lot of it is directionally correct. I've got big problems with Section 15, though, and so I will be working with the chair on that piece.
I appreciate that, Representative Ingalls, and thank you to everyone for being here today. This bill aims to protect the integrity and stability of these programs to make sure that they're focused on supporting Iowans that most need them. We already have, I know there's going to be a lot of controversy and a lot of talk surrounding the immigration eligibility for WIC. We also apply this to SNAP. We also apply this to Medicaid. We apply this to Section 8 as well. This is nothing new. So Iowa is not going to be a sanctuary state for waste, fraud, and abuse, and we are going to move this bill forward today.
Work